Hello everyone, I'm Dr. Cheruba Prabakar. I'm a board-certified OBGYN and welcome to my YouTube channel, TheFibroidDoc. This is actually a perfect time to launch this channel because it's July 1st and July is Fibroid Awareness Month. And through this channel, I want to share with you everything I know about fibroids. But first, let me start with a quick story. So last week I had a patient come to my office to see me. She was 45 and a mom of 2 teenagers, and she had this issue with bleeding. Okay, so she was bleeding a lot during her periods, and sometimes even when she was not on her period, bleeding through pads, tampons. She even had to use diapers sometimes. She would bleed through her sheets at night. Forget like going on vacation because she would never know when she would have this massive, amount of bleeding. She would even have to go to the ER to get a blood transfusion at times. It sounded just miserable. She told me she had to call off of work at least 2 or 3 times every month because she could barely get out of bed. And it was clearly impacting her quality of life, and it just didn't sound like a good way to live. And most importantly, she couldn't enjoy time with her family and be there for her kids like she wanted to. So unfortunately, this story is not that rare. I hear these kinds of stories all the time, every single week, several of them. And as you listen to the story, maybe you're thinking, that's me, or that's my mom, or that's my sister, or my wife, or a friend. We all probably know someone with this kind of story, with bleeding because of fibroids. And with that, let me tell you 3 quick things about fibroids. Fibroids are actually really common. They affect about 20 to 80% of women by the time they reach 50. So if you are a 50-year-old woman going out to dinner with your friends, with 5 of them, up to 4 of them are going to have a fibroid. Now that's really, really common. Secondly, fibroids cause bleeding, and they can also cause pain or pressure. So 2 main symptoms: bleeding, pain, pressure. And lastly, there's actually something you can do about fibroids. I see a lot of women as a physician, 50, 55, having a lot of symptoms from fibroids and just feeling like they're not equipped to make a decision about their health when it comes to fibroids. So I want to let you know that there is a lot you can do medically and surgically and lifestyle-wise, okay? So those are the 3 main things I wanted to share today as we kick off Fibroid Awareness Month. So first, they're very common. Second, bleeding and pain are the most common symptoms. And third, you can actually, do something about them. And a little bit about me. I am a board-certified OBGYN with a fellowship in minimally invasive surgery. I practice in Oakland, California, and my subspecialty is really, taking care of women with fibroids. This is my interest. I spent a lot of time in fellowship doing this, and it's something that I've developed over time. And I see a lot of women with fibroids in my practice, and I want to help you through sharing the information that I know about fibroids to help you live a life where you are not bleeding, where you are able to go on vacation and wear white pants, because we know no vacation is complete without white pants, seriously. And just have a good quality of life, spend time with your family and your friends, and not have such issues due to fibroids. So if this is appealing to you, if this sounds like you, if you know somebody with fibroids, please subscribe to this channel, tag them, share this channel, and I plan on sharing information with you weekly about fibroids. And if there's a specific aspect that you want to learn about, please comment below, or you can send me an email, TheFibroidDoc@gmail.com, and I'll address them. Okay, so have a great day, and thanks for listening. Bye.